I'll go ahead and get us started, and as people join, they can catch up. I wanted to start just with a welcome. My name is Peggy Conway. I am your new Director of Neeley Alumni and Constituent Engagement. I am new in that role, but not new to TCU. Been at TCU Neeley for many, many years, and that's why it's so much fun for me to see familiar faces and names on this call today, so welcome everybody. I can tell you that in my new role as Neeley Alumni and Constituent Engagement Director, that's a long title, isn't it? That our goal with alumni is to make sure that we serve as that Neeley is your lifelong partner in your success and that you are a lifelong partner in our success, right? That's our commitment to you. And to help us accomplish this goal, we have held numerous focus groups and talked with alumni and tried to understand what's on your mind. And there's been some recurring themes. One, we've heard from you guys that you would really like more opportunities for continued learning and growth from Neeley. And then we've also heard that would like to have more opportunities to connect with other alumni. And that's really what today's session is going to be all about. We've launched a couple of new programs to this end. One is called the Alumni Advantage Series. And in fact, you may have just received an invitation a few minutes ago for our next Alumni Advantage event. It brings alumni together. It's an exclusive program for alumni. It's a lunch and learn with our faculty experts. And the session that's coming up in April will feature Mary Olbein from our management department and focus on digital transformations. So we'd love to have you join us for that. The second program that we're launching is this one, and it's called Neeley Networks. And the concept with Neeley Networks is that we bring alumni together, particularly alumni in a specific industry, have a great speaker who has relevant topics for that industry, have some Q&A, and then give you a chance to break out, network, get to know each other, and discuss those issues. And really, that's what today's agenda is going to look like. I'm going to take just a few minutes to introduce some of our TCU team that's here today, and then we'll get started with our wonderful speaker. Again, you'll have a chance for Q&A. So if you have questions during this, while the speaker is presenting, feel free to put them in the chat and we'll be monitoring that chat. And then following that, we're going to break out to some networking sessions. At the end of the networking sessions, we're going to come back together, and I'm begging you to stay engaged until that point because we're going to poll you for some information because we want feedback from you for this session so that we can build the next session to be even stronger. Our objective with this Neeley Networks is to be able to bring you guys together as a networking group several times a year. So we want feedback on how to build it and make it more useful for you. So with that, I'd like to introduce two of our wonderful leaders from TCU Neeley who are joining us today. First, we have Dr. David Allen, who holds the Luther Henderson Endowed Chair of Management and Leadership. And yes, I read that, so I wanted to make sure I got that right. In addition to serving as our Senior Associate Dean for Graduate Programs, Dean Allen just wrapped up several years as the Editor-in-Chief of the Journal of Management. So that tells you a little bit about his expertise, quite impressive. And we also have with us Dr. Valerie Johnston, who in addition to being an Associate Professor of Management and Leadership, also serves as the faculty lead for our Healthcare MBA program. Prior to her academic career, Valerie also spent about 15 years in the industry, including a role as SVP operations for, is it Piedmont Healthcare Management? Is that where you were? So with that, I'll turn it over to Valerie.
Thanks, Peggy. David, I'm going to have you offer a few words of welcome if you don't mind, and then I'll take it back and introduce our speaker and we will move along.
Sure, happy to. Thanks, Peggy. Thanks, Valerie. Thrilled to see y'all. Thrilled that you're here with us today for really our inaugural Neeley Networks event focused on healthcare. I'm super excited about this for several reasons. One is I think it's a great example of, as Peggy was mentioning, our commitment to lifelong learning. So the world is such now that it's no longer sufficient to think about your education as just you do 4 years and then you're done. Or even you get a graduate degree and so you're focused for a couple of years and then you're done. But it's got to be some online continuous growth, and this is our commitment to help you continuously grow your worth. I think it's also a great example of Neeley's promise to operate at the intersection of scholarship and practice. So we're creating new knowledge and new ways of thinking and also helping professionals like yourselves to change the world and change the practice of business. And I think you'll see that captured today once we introduce you to our speaker. It's going to be fantastic, and he's a great exemplar of this idea of integrating research and practice. This event is also a great example of Neeley's promise to be personal, connected, and real. Like Peggy, I very much hope you'll stay and keep the opportunity that's at the tail end of this to continue to build your networks. I think that many of you are already connected or have some relationship with Peggy in some way in her role, but if you're not, you should be. So I hope you'll take advantage of that opportunity. And then finally, I'm just super excited about this as an example of our focus on the business of healthcare. Healthcare is clearly, it's so important, it's so dynamic, it's so challenging in our economy and really in our society more broadly. And all of the current issues that we have going on, for example, the ones that are requiring us to be together virtually instead of together today, have just emphasized all of that even more. So in addition to events like this one, we're going to make you aware of some other opportunities for people who really want to dig in and continue your professional development along these lines. We have a super high quality healthcare MBA program that Dr. Johnston will give you a little bit of information about. We have great executive education offerings that are really strong in the healthcare domain. For example, we have a physician leader program that I hope that you will have the opportunity to go and check out. So thrilled that you're here today. Thrilled that you're taking this opportunity to remain connected with Neeley and with each other, and go Frogs.
Thanks, David. So I always appreciate the opportunity to share with folks what we're doing with the Healthcare MBA. And many of you, while you are in the industry, probably may not be aware that Neeley launched several years ago an MBA with a focus in healthcare. I will not take time out of today's session to say a whole lot about it, but if you're interested, April 7th, we're doing just a quick lunch and learn for anybody who wants to get more information about the program. And so you as an alumni, feel free to register and join us if you would like to engage with the program and learn more about it in some way. So appreciate you being here today. Without further ado, I want to introduce you to Ben Isgur. Many of you may have joined today so that you could hear from Ben. And so we want to have plenty of time for you to do that. Ben is the managing director and PwC's Health Research Institute leader. He actually helped to launch the Health Research Institute, and he leads a team of industry experts, policy analysts, and economists who develop original and independent thought leadership for PwC and its clients. The Institute's reports and analyses are regularly cited in congressional hearings, by journalists, in trade association, and by scholars in their academic work. So their work has broad appeal. Ben himself has written many of HRI's reports, and he is also very frequently interviewed and quoted by journalists from media organizations related to all things health industry trends. You'll find him quoted in the New York Times, the Wall Street Journal, the Washington Post, The Economist, Modern Healthcare. He's been on CNBC's Nightly Business Report and NPR's Marketplace. As somebody who has spent a career both being fascinated and perplexed by the healthcare industry, I always find Ben's remarks useful and thought-provoking, and I hope you will as well. So Ben, take it away.
Well, thank you so much, Valerie. And it's great to be here again. And what a wonderful group of people coming together to talk about some of the toughest issues of our time. Maybe it's a testament to my inability to explain healthcare that I've been on so many media channels and we still don't understand it. So who knows? David, I really liked your remarks and the point about the healthcare is important and it is at the intersection of so many things. And I think that really connects well to our research for this year. There are so many different things happening and connecting. And we did something we don't normally do when we publish a look ahead to major issues for the health system. We kind of pride ourselves on being able to answer questions, but we actually titled our report this year, "Will a Shock System Emerge Stronger?" with a question mark, something that we don't normally do, because actually we're not sure what the future is going to hold. A lot of what I'm going to talk about today is driven by what we learned from the pandemic. And I do think there is a bit of a misnomer there. At the beginning of the pandemic, we said that the pandemic is affecting all of us and we're all part of this. Well, the reality is, as the year went on, we realized, no, it's actually affecting different people, different ways, different communities, different ways. And we actually saw a lot of cracks in our health system when it came to testing, when it came to treatment. Now, as it comes to vaccine rollout, we're actually not all in this together. Some of us are in a great position and others of us have almost no resources or access to the health system. So, I mean, there is some gravity in terms of what's going on out there. And I hope that comes out as I talk through some of our trends here. If we wanted to roll this up, I mean, I've got 6 issues that I'm going to cover, but just at a higher level, if you had to put it together, a couple of major themes we thought of. One is around resilience. And when you have a pandemic, you have a disaster, you have any kind of stress on the system, resilience comes up. And there's a natural tension between efficiency and resilience. For those of you maybe interested, on the supply chain side, just-in-time supply chains often are not the best in terms of resilience. So there's tension there. We have to figure that out. I think the second thing is around the digital surge. And granted, many of you work in the health system and you've heard this a million times. Yes, we are moving to a more digital, technically enabled health system, but we all have to admit the pandemic sped that up. And I think we've got the data to really show that and to prove that. And then the other thing, of course, I think that is woven through here is what's happened in terms of our mental health, the cracks in the system, what I would call the social determinants of health, all of those things outside of the traditional health system, which became very apparent we have not solved, those issues. So I'm going to walk through six major issues, and I'm going to admit right now, we're very into data at the Health Research Institute. All of our work is not just a point of view, but it is research-based. And so we conduct consumer surveys. We conduct surveys of healthcare executives. We engage in a lot of one-on-one interviews with healthcare executives to kind of get behind the scenes, what's really happening on the ground. We do about 200 of those a year throughout provider, payer, pharma, life sciences, new entrants and technology companies, government, other thought leaders. So there's going to be, don't be afraid of the slides. I like to have data on there. I'm not going to go through all of it, but it's going to be there for you. And after this presentation, all of this will be, freely available to you. The mental health issues here, we just wanted to give just a little bit of a taste. And I think we set it up purposely this way with kind of a more than just an overview of, yes, our US households have people who have been suffering from anxiety or depression. I think we all know that intuitively. But if you look at our background here of kind of the archetypes of who's least affected, who's most affected, I do think it shows it very clearly why a health system intervention needs to be very specific. The days of kind of spray and pray, the shotgun approach for health system interventions are over. It is very clear that we have to have very specific interventions depending on what community we live in, what zip code we live in, our income, our education, all of those things. And I think the data shows that very well here, just in terms of who's been most affected by the mental health issues during the pandemic. Let's start out with our issue number one, and I'll go through with a bit of pace because we're going to leave some time for Q&A here. Again, this is the Captain Obvious part, right? We've had an explosion of virtual health. A lot of that was born out of necessity. If we went back a year ago during this time, it was an access issue. And that's why we get these numbers that you don't often see, where we have 92% of our healthcare providers in our survey said, yes, we're using telehealth for primary care services. It's helping, for follow-up appointments. It's certainly helping with mental health. We're now seeing that we'll probably have a permanent mental health channel through virtual health and telehealth. We're seeing fewer no-shows. We're seeing better better consumer interest in that. But telehealth and virtual health is not always a panacea. There's a lot of work to be done, and I think part of that stems from what have they really been focusing on around virtual health? And one of the things that they've been worried about and concerned about is actually reimbursement. So you can see from our survey here of health leaders, 52% said reimbursement's the biggest challenge. Why are they saying that? Well, right now you're getting paid equally, whether it's a telehealth visit or in-person visit. And they're kind of looking ahead and saying, how long is that going to go on? And when is that reimbursement going to change? I'm concerned about that. I think the second big concern you see here is around ancillary services. This is both a reimbursement issue because a lot of times now your virtual health visit is not translating into the prescription getting filled, the MRI or the X-ray happening, the follow-up specialty appointment happening. So obviously there's an operational and there's a revenue side of that, but there's also are we helping our consumers navigate the system, and can we do that virtually? Where you see less focus from the health leaders are on, physician issues around telehealth and virtual health and consumer willingness. And I think this is where we see that kind of cracks in the system. Actually, not everyone's having an even experience with virtual health. And if we look, you can see some of the numbers here. 66% of Black consumers, of Latinx consumers experience at least one issue with a virtual health service compared to about half of white consumers. And what are we seeing there in terms of some of those, challenges? People saying they don't know where to go next in terms of the services. There was technology problems with the services. Here you can see our consumer survey and that breakdown. I had technical issues. I felt uncomfortable being on video. My problem cannot be addressed. The one that I'm really intrigued with is, I'm not clear where my follow-up steps need to be. Where do I go next? And I think this is going to be the challenge for our health organizations over this next year is we now have one foot in the in-person, one foot in the virtual, and how do we make that really seamless for consumers? And I think the second challenge is how do we make sure that our movement to virtual doesn't create even more disparity? So we see some examples of there's some payers out there that are paying for people to have a device at home, that can, automatically log on and get to a virtual visit. So, a big investment saying like, we're going to give you a tablet, you keep that at home. When you need a virtual visit, you've got kind of a one-touch log on. So it's about the technology, it's about the hardware, but it's also about the ease. I think the other thing competitively, our notion, if you're a hospital provider, your notion of what your market is largely based upon the geographic zip codes around you. If you're a center of excellence, you may be bringing in people from some other geographies. As we move to more virtual, especially with centers of excellence, do we now kind of open up to a nationwide market competitive landscape, which could be both positive and negative, both opportunities and challenges out there. So a lot of things to consider on the virtual health side. Obviously, very positive. HRI, we've been talking about it, touting virtual health for the last decade. Here we have it, but there's some things to work out along the way. Kind of along the same vein, a little bit different. Let's move over to clinical trials. And for our folks out there who are working with pharmaceutical and life sciences companies, biotech companies, the challenge around clinical trials. Some of you may have noticed personally, as I did during the COVID vaccine trials, I attempted to sign up for a few. Looking at the geographic location, one of the ones I tried to sign up for, they said the site where I would interact was like north of Plano. So those of you that are local, live here in Fort Worth, that's a trek, right? You got to drive over to Plano for your clinical trial and back. That just shows that the distribution of clinical trials are going to be important if we want them to move forward. Anytime we can move to more of a virtual environment with clinical trials, some of the intake, some of the follow-up, that's going to be helpful as well. Another survey kind of first for us, across the board, pharmaceutical and life science executives are saying, yeah, we're expecting that we're going to make some big digital investments in clinical trials going forward. 93% said that the virtual trials are important to their company's pipeline over the next 5 years. And then, of course, take it now to the consumers. Consumers are telling us overwhelmingly, I'm going to be more likely to participate in a clinical trial if I can do so remotely. That's going to be some combination of, I want the physical part of it closer to me, and I want a lot of the in-between things to be virtual to make it easier for me to participate. Extremely important there. What are some of the implications of that, the things that we need to think about? Well, I think one is, certainly with clinical trials, we now have much more focus on diversity. You saw that on the clinical trial readouts with the vaccines, that the readouts were including gender, age, race, and that there was more diversity in those clinical trials than we may have seen in the past. How does that connect to virtualization and distribution? Well, people who don't have a lot of resources, it's going to be hard for them to drive or to transport themselves, 60 miles across an urban center to go to a trial site, or 30 miles across an urban center, or take time off from work or things of that nature. So these things are all highly connected together about how we can use technology to even bridge some of those gaps as well. I think the other thing we're seeing is that the contract research organizations that often run these clinical trials, they are, scrambling to introduce more decentralization, get things closer. And so I think we'll see in the future, maybe non-traditional trial sites. Could we see some of the retail health clinics become trial sites? Could we see some of the distributed laboratory sites become trial sites? So, and then of course the home itself will be part of that as well. The third major issue that we want to talk about is around the digital relationships for physicians. The GAO put out a recent report about the state of America's health system, mainly focusing on hospitals and health systems. And of course, one of the things they talked about was the clinician burnout because of COVID. There's more pressure than ever on our clinicians. And for those of you that are clinicians or work with clinicians, I think you certainly see that. But there's more than just this. Burnout was happening actually before the pandemic. Some of this burnout is because of administrative work. Some of it is because of technology. And I think the question has been out there is, the technology that we're using with clinicians, are we actually making their lives easier and giving them information that they need at the point of care? Or are we making actually the lives for them more of just a checkbox exercise, and it's making it more difficult for them? So that's one issue we wanted to think about. I think the other issue we saw with the pandemic is that for the pharma companies out there that have marketers and educators that go out and they're walking the halls, they're talking to physicians, they're talking to hospital and clinic executives, they're talking to payers. What happens when you have to move completely virtually? And how does that change the relationship between the two? Well, we talked to a few pharma marketers kind of on the ground to get what their life was like. And they did have to move to more digital interactions, webcasts like we're having now, and discussions, texting, social media. And what was the interesting thing that we found is that for some, it actually burdened the relationship. They were having a harder time getting in touch and having those conversations. But for other physicians, actually it became easier for pharma marketers and educators to discuss with them. They actually liked the fact that it was a virtual communication, that it didn't kind of take up time during their day, that they could have that interaction over a different time frame. So what are the things we maybe want to take away from these digital relationships and how they're changing over the next year? Well, one, I just kind of alluded to, the pharma clinician experience, a popular business term, omnichannel. This means that, look, there's going to be a lot of different ways those relationships are going to be happening in the future. It's not just going to be lunch and learns, but we're going to see more digital interaction. For our physicians and clinicians, we've got to make life easier for them. Having PDF versions of materials are not going to cut it anymore. They need interactive tools that could help them communicate with patients. I think for the system in general, we're going to see more focus on human-centered design in terms of how our clinicians actually perform tasks, and how can technology make that easier for them, and how can the physical environment make it easier for them. So for some of you who may be working in more of the architectural design world of healthcare, that's going to be extremely important as well. This was a really interesting issue to me around forecasting. When the pandemic started, we had some national models that we were following and others were following. And what we found very quickly, especially in the beginning, when we were still talking about ventilators and we were talking about PPE, and we had states that seemingly had a lot of COVID cases and we had states that seemingly had no COVID cases, what became very clear is that the whole health system, we were all there with blinders on. We had no ability to really see any level of data that would allow us to make some operational actions, that would allow us to implement anything. And that's why probably you're seeing here that 3/4 of healthcare executives said they're going to be investing more in predictive modeling in 2021. The national and global forecasts don't help you in your service area. They don't help you at a zip code level figure out what you need to deliver and what's coming your way. What we saw was a lot of kind of cottage industry, local academic medical centers partnering up, spinning up their, data analytics, with their research groups on their universities to try to get better data and information. More layering of data. So knowing someone, a high positive COVID area or an area that needs vaccines more than another zip code doesn't really help you if you don't have other data layered in about the social determinants of health and how you need to put that in that intervention together. And a lot of missed opportunities you can see here from some of our survey data. We asked doctors, how worried are you about we asked consumers how worried they were about going back to see the doctor for in-person during the pandemic. We broke it down by actual, these groups' health status. And you can see the worry level. And you can also see layered on top of that our survey information about have they gotten health information from their doctors and health systems during the pandemic. Now, this got better towards the latter part of this year, but at the beginning, we had very few consumers who said they'd heard from their doctor or their health system. So we may have had a lot of missed opportunities there. You do not need to read this, but we went through and did an archetype of someone moving through the system when you don't have this forecasting ability and when you do have this forecasting ability. And the real point we want to make here, this is fully in our report, is that you actually need another layer of information. Do they have chronic conditions? What does their air quality in their area look like? Are they in a food desert? What's the virus looking like in their area or anything else that comes in the future? What kind of insights do we have about their consumer preferences? So it's a lot of data that needs to come together for this forecasting, not just kind of looking at a national level. By the way, we still need this. This isn't over. I mean, the pandemic's obviously not over, but look, we're still wrestling with these same issues around vaccine distribution, and we'll be wrestling with these issues in terms of the next ones that come forward. So investing in forecasting is going to be a big piece of what we see. We often try to talk about what do we think is going to happen in terms of mergers, collaborations, JVs, the portfolios that are out there. This is a really funny year to kind of look at that for 2020 and then look ahead for 2021. I mean, obviously there were some incredible ups and downs in terms of revenue that was happening in the health system. I mean, we had a quarter with almost no utilization, where of course hospitals and health systems were hit really hard, to the point where we even had some physician groups that needed loans to kind of keep going. And then we had, payers who had a quarter where they weren't really paying out claims, so they had a bunch of cash available. And that's where you see this analysis we did on risk-based capital and how that really increased. And the kind of question, though, is not so much what were those little blips that happened over the last year, but where do we go from here in terms of the collaborations that we think we're going to see? And I think we'll see them in a few different areas in terms of investments. I think one goes back to our thesis at the beginning around the digital investment. Obviously, insurers are and well-positioned providers are going to be able to continue those investments. So that digital could be just what we were talking about with, better forecasting. It could be more investment in the digital, in digital in terms of virtual healthcare. We're certainly starting to see that with larger hospital systems saying, hey, our capital infrastructure is going to have a bigger mix of bricks and mortar and digital. I think we'll see some challenges as well. We've got some struggling providers, some in rural areas, some in urban areas, and they may need to get on board with a larger organization to survive in 2021. I think we'll continue to see some of those conversations happening. For pharma and life sciences, I think we're going to get back to gene and cell therapy investment. I mean, that's kind of fallen off the radar, not the investment, but just talking about it, because gene and cell therapies were getting really hot right before the pandemic. And then kind of the pandemic took all the air out of the room. But that's certainly where the big play is for future innovation. So investments in R&D there as well. All right, let's talk a little bit about the supply chain. And this one is another one which was really fascinating to us. There's some levels of this I think that are kind of very obvious, and I think we'll just be reinforcing your own thoughts on it, but maybe some other areas to think about differently. Again, a lot of focus here, right? 94% of our life science executives, 86% of our provider executives said that they're going to be improving their supply chain. That's a priority for them in 2021. Improving the supply chain security, finding the right mix of suppliers, understanding and managing third-party risks. But I think there's actually a great kind of encapsulation of why this becomes so important. And so I think let's look at the mRNA vaccines and what that supply chain looks like. So for the mRNA vaccines, you need DNA plasmids. St. Louis, Missouri is one of the places where you can get those. You need to transfer your DNA into RNA. That can get done in Switzerland. That can get done in Massachusetts. You need to encapsulate those in lipids. Some of those are developed in Alabama. You need to create lipid nanoparticles. That Vancouver, Canada is where a lot of that is done. You need fill and finish of the final product. Michigan's another place that's done. If you kind of started zigzagging all the places I just talked about, and obviously there's some others, but I mean, you're all around the United States, you're all around North America, you're over in Europe and back. And, it's hard enough when there's a pandemic going on, but you'd think that like if one other thing happens, the volcano in Iceland erupts and shuts down commercial air traffic over Europe for 2 weeks. The Suez Canal is blocked and things can't as easily get done through for 2 weeks or 4 weeks. I mean, this is, I think, what keeps supply chain executives up at night, is that we've kind of gotten used to the fact that we've got this super efficient global supply chain, and it's always going to be there for us absolutely overnight. And we woke up to find out that actually that's not the case. And in fact, I think a lot of executives realize they don't even really understand the depth of where their supply chain is, where the vulnerabilities are. A lot of things are sole sourced. They don't have a second alternative. And by the way, when you're trying to find a second alternative when everyone else is as well, it's kind of too late. So that's the kind of thinking that we think we're going to see. We may see some reshoring. That's not always going to be the answer. I think we're going to see a lot of looking at just understanding where it is, mapping out where the vulnerabilities are, and a lot more relationships being built around creating new suppliers and collaborations so that you're never kind of beholden to one issue. So I've covered a lot of these implications already on this. The other one I'd like just to add is kind of the end-to-end and the last mile to the consumer. And I would just posit this to everyone on the phone, that if we think about vaccine distribution, I mean, isn't that really the last part of the supply chain of the vaccine, right? I mean, we did a recent report that we titled, vaccine, creating vaccines are not enough. It's all about vaccinations. And so that last mile becomes incredibly important. How do we actually get it to the consumer? And I think that goes back to some of the things I was talking about with social determinants, understanding the community, having that forecasting ability, understanding consumer preference data, understanding, the challenges that are out there by zip code becomes really, really important for that kind of last mile piece. Let me just end with that and just say, I know we're going to be opening it up to Q&A. I'm looking forward to that. Everything that I've talked about today is freely available. You can download it from our site. And also, I'm also happy to share the slides with anyone who needs it. And with that, Valerie, shall I turn it back over to you for Q&A?
Yeah, not a ton of questions. There's a lot of, I think, people wanting to network with one another, and that is fabulous because that's part of the reason why we're here. There was one question, and maybe even some help from the audience, Ben, but Katie Kindred is asking, is there really any data at this point surrounding patient outcomes related to telehealth visits and appointments?
Well, I mean, yes, there are some. I mean, and certainly around primary care, the outcomes seem to be good. I think on mental health, again, we're in early days. So when I say outcomes, I mean, we don't have like good peer-reviewed data on that yet. But I say on mental health, behavioral health, it's looking very, very positive. I think the issue is, as you get into the more complicated things, is the system set up to create care teams for virtual health, right? So I think we're kind of in that infancy stage of it's very transactional right now.
Thank you. I was mainly worried about those two.
Oh, awesome.
And Kristen, Kristen's asking you, Ben, Kristen Tusmer is asking you if you could talk a little bit about the business implications for reshoring.
Hey, hi, Kristen. I think a couple of business implications there. I think one is, there are some potential tax advantages to it. So I think the federal government is, trying to incentivize companies to reshore. I think the challenge is we've gotten very used to the costs being efficient. So I think the business implication to reshoring is how do you navigate that? And one of the things I would point to is that during the pandemic, we saw a lot of material flow into the United States that was counterfeit. We saw a lot of material that wasn't up to our standards. And so I think for those of you who are manufacturers and suppliers, I think the quality, the accessibility, and the kind of fair warning that you kind of get what you pay for are important points to make from a business standpoint. Yeah.
So a couple more questions and then we're going to move into the networking. But Susan is asking, again, a follow-up question on one of your trends. So the forecasting, as we know, is only as good as the assumptions and the data inputs. So how good is the data and access to the data to help us improve forecasting?
Well, I think it's getting a lot better. And I think there's certainly, look, I know there's several of you on the phone who work in this area. So why would I say it's getting a lot better? I think one is we are getting, more, I guess we're getting closer to more real-time data in terms of, the EMR, EHRs, and more of those being connected. And again, that also shows the danger, right? When we have silos and we're in a bunch of different EMRs, then it's hard to get a full picture. I think the second thing is I am seeing a lot more sophistication around the other data layers that are going in, the zip code level data in terms of the social determinants. So I think that's positive and trending the right way. And then last but not least, look, there's been a lot of investments by health systems, providers, payers, and pharma to a certain extent as well, and CRM investments. And so taking that data and making it more actionable in terms of how you communicate. And I think that begets better data as well. If you get that communication cycle going, you're going to learn more about consumers. So I think the trend is the right way, but we're certainly not there yet.
So last question, and I'm going to turn it back to Peggy. So Brian Van Eck asked a question I think many of us are concerned about. So do you think we're going to see some legislation or regulation to increase reimbursement for mental health? Lack reimbursement seems to be what has sort of decimated the specialty to start with, and now the pandemic has brought that to light.
Yeah, that's a great question. And it's one that we've wrestled with. I'm not sure I'm gonna be able to give you a great answer on that, and as you know, because of the reimbursement, we have so many mental health professionals that are out of network for insurance. And so, so I've got a look, so I don't know the answer on the reimbursement piece. I would say that is a key. That is a key though. And we need to fight for that. But I would say the second thing is I do think we are going to get some virtual capacity through the virtual visit. So I've talked to many mental health professionals and they just say they can simply see more people in a day virtually. They have fewer no-shows. And then the last piece I would say is thinking about mental health professionals more broadly. One of the things that I definitely saw an uptick in trend on during the pandemic were people dealing with stress and eating disorders. And so we're seeing like dietitians and nutritionists being part of that mental health capability. And so I think we do need to think broadly. And frankly, look, a lot of our pediatricians and primary care physicians are moonlighting, doing a lot of mental health as well.
Awesome. Thanks so much, man. I think you can tell by the questions that the audience was paying attention. So that's always good news.
Thank you.
We really, really appreciate you kicking this off for us today. Can't think of a better person to help us look at the big picture of what's happening in the healthcare system. So thanks so much. Peggy, I think some folks may want to do some networking. So
Absolutely. Thank you so much, Ben. So what we're going to do now is break out into some Zoom breakout rooms and give you a chance to meet in small groups and make some connections and talk about these issues. And then we'll bring you back together just before we close. And please, if you will, stay on so that way we can get some feedback on how to make this session even better for you next time. So with that, I'm going to send you to the breakout rooms. It's so fun to see some names.
Thank you so much.
And Peggy, just to
Yes.
so am I good to go, or did you all
You are good to go.
Okay.
And we
Awesome.
just appreciate you so much.
All right. Well, thank you all so much. Valerie, good to see you. David, nice to
yeah,
meet you.
good to see you,
Thanks so
Ben.
much, Ben.
Thanks.
Okay.
A lot of people, familiar faces in the crowd for you. So thanks so much.
Absolutely. All right.
Take
Bye-bye.
care.
Valerie and Peggy, that was great. I'm going to jump off too.
Yeah,
Okay, thank you
thanks,
so
David.
much.
Yep,
I'm sorry I skipped you, David.
no problem. Worked out.
Nice save, Valerie.
It's all good. Thanks, David. Good job, Peggy.
We have a few folks who are, have not gone to their
Yeah, they may be.
breakout room. So if you're here with us, hi guys.
Mhm.
We just need to watch
Multitasking
the
is what we
time.
do.
So I've been putting out fires during that.
Oh, good for you. I can't do that. I have to pay attention. It's just.
Yeah. We had the little logo issue I'm still trying to fix. So.
I do believe the recording also transcribes the chat since folks are putting their titles and such in here. So we'll have to figure out what to do with that. But
Oh, you know what? I didn't enable live transcript.
oops, that's all right. Well,
So what I can do, let me go to the chat. The live transcript would have caught all of his comments. So I'm going to copy and paste
okay.
as much as I can. Yeah, I can get it off. It also shows any, since I'm doing it, it shows any conversations I had also. So
That's okay.
a couple of people and I said hi.
That's okay.
It's like Kathy. Hey,
Back in the breakout room,
sure. Let me see.
they can't hear me, which is unusual, right?
It's so good to see you.
I love you.
Where are you supposed to be? Do you know? I can't find you. Oh, There you are. There you are. Move to room. Okay, I'm gonna have to move you into a different room. It won't let me put you back in that same room. I'm gonna move you to room 1 and then I'm gonna move you to room 2. So just, how's that work?
They don't know me.
Okay, hang on. Okay, you got it now? Okay. All right, I got the chat. Let me watch the time.
Can you put Kathy back in room 2 now? She's back.
Oh, it didn't work? You're muted.
I'll just hang out with you. I'll be fine.
I'm so sorry. So how are you?
Good, good. I like your new role. How long have you been in your new role?
I've been in my new role for a minute.
Yeah.
Actually, I rolled out of admissions a little over a year ago, and I was going to be, and I was, for graduate programs, student and alumni engagement. So looking for those intersections.
Sure.
And then our alumni director resigned and we were in a hiring freeze. So I became the alumni director.
You're the perfect person. You really are.
Well,
I know
thank
you don't want to hear that, but
But thank you. So it was fun. So how are you doing?
good, good. I'm over here at James L. West.
Yeah, I saw that.
So not too far from the campus. So we have walked the road of COVID every single day.
Yeah.
Hand in hand, we lost 15 residents to
Oh, I'm
COVID
so sorry.
last year.
Wow.
And so we talk about supply chains and things like that, and ventilators and all the acute care partners are crying their woes, but post-acute is still ill-equipped for a pandemic. And so those supply chains are really non-existent, especially for single site, entities like ourselves. And then to lob on top of that, we're private pay. So we don't participate in Medicare and Medicaid. So we're not getting financial support or equipment or supplies or anything from the government. So when they say they're sending things to the nursing homes, not to us.
Not to everybody.
And there are only 7 of 1,200 nursing homes in Texas, there are only 7 that are private pay. And there are 2 in Tarrant County.
Oh, wow.
Yeah. So they call me the fairy godmother. They said, we need X, off I go, and I bring it back. I'm like, what else do you need?
Kathy, do you think this actually is going to threaten the viability of sort of single site private kind of institutions?
I really do. And I think that, we've already seen closures of nursing homes in Texas because the federal money is not going to be coming like it has been. So I think you'll see more of that in the rural areas. Who's going to care for the people that need to be cared for?
Yeah.
So, and then of course, Medicaid expansion is huge, because that's really who's out in the nursing homes for the most part.
Yeah.
So, I think the post-acute sector, it's always been broken, but COVID brought the magnifying glass to the sector, and from workforce development to supply chain to you name it, everything needs to be addressed. So,
yeah.
And me, I can't leave anything alone.
Oh my gosh. How's your family doing? Everybody good?
Things are good. So my husband opened a restaurant in the middle of the pandemic.
Nice. What did he open?
He opened 360 Smoke Shack over here on 7th Street next to Velvet Taco.
Oh, nice. I haven't been because I haven't been out, but I will do that.
The barbecue restaurant. And so only people that are in the industry and are bitten by the bug open in the middle of a pandemic, right? But if you can take off in the middle of the pandemic, then kind of a sure thing, right?
Yeah.
Knock on wood.
Well, he knows what he's doing.
Tell me that name again.
Smoke Shack.
Smoke Shack. Gotcha. We like trying new places, so.
Yeah, next to Velvet Taco. So, yeah. So, but they were talking about like the counterfeit PPE. We had 2,000 counterfeit N95s sent to us.
Oh, that's crazy.
It's the pandemic. So MedStar fit tested our equipment and said, throw these away. These are not good.
Well, we haven't given him a whole lot of time to talk.
Yeah, but I feel like you're going to lose people.
So I'm going to give them a notice that we're going to bring them back in a minute.
Yep.
They were having a hard time with structure versus unstructured. Like these are highly structured people. So they said, are we supposed to answer any questions? Like, what are we supposed to do?
Oh, that's interesting.
Unstructured time.
I should have given him more instructions.
Funny.
Like Montessori, go entertain yourself.
Yeah, that's interesting. Okay, yeah.
Okay, I just told them we will close in 1 minute. Well, we'll just call it speed networking.
There you go. Will you be sending out a list of who's on this call? Or how do we continue networking from here?
Yes.
That's what we've got to figure out, kind of the what's next pieces and how to share the slides and the.
We have to get permission.
Yeah.
That's the thing, is we have to get permission. And so in the registration questions, we should have asked, do we have your permission to share?
Sure.
And so
I think we can share the ones who put their information in the chat. I mean, that's kind of.
oh, absolutely, but we can also share the others. And so
Right.
we'll do a quick little
Right.
survey.
Right.
Sorry, Peggy, I couldn't leave well enough alone. I was like, let's introduce ourselves.
Yeah, no, I'm glad you did. Because we want this to be more interactive. We're just trying to cram a lot in an hour. And that's what the polls that we're about to do are about, is how to help us give you more time to. Has it been a minute? Okay, I'm going to close the rooms.
Yeah, because it'll give them another minute probably if you close.
It did, you're right.
Mhm.
So one of the questions, Kathy, is for us to give people time to do all these things, are people willing to give us more than an hour? Because it's hard to get it all done in an hour. You know what I mean?
So, I think if they find value, they'll stay. And if you'll get the people who are really committed, and people always could leave before it's over,
Welcome back. Welcome back, everyone. Welcome back. That was your speed dating networking assignment there. We're gonna give everybody just a few minutes to get back. And then we're gonna do some quick polls. And really what it is, it's feedback from us. What did you like of this? What do you want more of? I'm guessing you might want a little more networking time, right? So give us that feedback so we can structure it in a way that's most useful to you going forward. So I am going to flash the poll questions up there and let you guys answer. And if anybody's just joining us back and she'll give us some more feedback, that would be great. We're about halfway there. And while you're doing this, I'll let you know that we are targeting the September-October timeframe for our next gathering. And we are waiting more instructions from the university about what our COVID environment looks like for the fall. And that will help us know if we can offer hybrid experiences, if we're virtual only as an only option, and those sort of things.
Peggy, also, can I ask you a question about this poll? What did you use to allow us to take this poll on the screen?
Just a poll within Zoom.
Okay, yeah, thank you. Because we have been using iClicker. I think this is much easier.
Oh, good. I'm glad. All right. It looks like the majority of the folks have voted. So I'm going to end the polling and I will share with you guys the results, which we will also look like. So it looks like people are interested in multiple opportunities. It looks like there's a mix of people wanting virtual and hybrid, and we figured that would be the case. So we're going to work our way through that. And lunchtime seems to be the most popular time. And continue with combination of content and networking. Fantastic. One thing we failed to do is ask permission from you guys to share your contact information with each other. And so I will be sending a follow-up email to ask you that. And if you're willing to let me do that, then we'll share that information with you. All right. Well, thank you guys so much. It is right up at 1 o'clock, so we're going to let you go. Valerie, any closing remarks other than thank you? And we're just glad that you guys joined us and really looking forward to doing this again soon.
What you said, thanks so much.